What's going on, guys? Dr. Choffner here, Dr. Physical Therapy, as well as strength and conditioning specialist, coming at you for another live video. This is our last and final video in our series on hip impingement. This is the most important video. We're going to talk about hip impingement treatment, how to fix your weak muscles. So if you guys haven't gone and kind of went back and seen the other videos, start with video 1, go to number 2, and then make sure you watch the previous one to this, which is video number 3, where we spoke last week about how to fix and regain your hip mobility when dealing with hip impingement. And we talked about 3 things. 1 is foam rolling, 2 is banded joint mobilizations, and number 3 is stretching. You have to get your mobility in check before you move on to what we talk about tonight. Okay, so if you haven't seen that, go back and watch it. Super important. So what are we going to talk about? 3 things in detail, as always, 3 important topics. Number 1 is early strengthening. We're going to talk about isometrics. Number 2 is progressing strengthening, talking about isotonics. And number 3 is movement re-education through motor control. Okay, if you're not really in the physical therapy field, you've never done it, or you're not in the exercise field, you're probably like, your head's spinning right now, and you're probably like, what is going on? What is he talking about? So stay tuned. I'm going to break it down for you right now so it's a little more simple and less complex. So early strengthening through isometrics, what does that mean? It's kind of like flexing your muscles and trying to keep them strong without actually moving your body. So there's little to no joint movement involved. It's usually partial range, okay? And that'll make more sense in a second. So if I want to strengthen my biceps, say like my chapstick here is my kind of little 5-pound dumbbell. Instead of me doing a bicep curl, if I have bicep tendonitis, it's gonna really hurt to do that. So instead I'll do a halfway motion. I'll come up halfway in the curl, so where my kind of elbow's right in line with my wrist, and I'll just hold it there for a good 10 to 20 seconds and squeeze that muscle. That's the same thing as isometrics. It's like squeezing a ball between your knees for time. And we're gonna go through exercise at the end of the video, so definitely stay tuned and watch that. Number 2 is progressing strengthening through isotonics. So this is like flexing your muscles through a full available range of motion, right? There's a concentric or a shortening phase, and there's an eccentric or a lengthening phase. So unlike isometrics, right, we're actually kind of taking our body through movements. So if we go back to that bicep curl example, instead of me going halfway through the range, I'm gonna just grab that kind of dumbbell again, right? We'll use my chapstick, and I'm gonna do a full curl and then come all the way down to a full stretch position. So this is the concentric portion where the muscle is shortening and the origin and insertion are coming together. And then as I'm lengthening, my arm's going straight, and then the origin and insertion are pulling apart. Okay, and we're gonna go through exercises again, like I mentioned. Number 3 is movement re-education through motor control, right? This is how your brain tells your body to move in a certain way. It's kind of like the boss of your muscles, right? Your boss tells you what to do, they give you tasks to complete. Your brain does the same thing for your muscles. It's your neuromuscular system. Your brain connects to your muscles, tells them what to do, and this is important for all types of activities, right? Especially for order, coordination, and balance. This is the last thing, usually takes the longest to get back, and it requires a lot of single leg activity, pulling in some bands, and a lot of advanced type of kind of work. Okay, so how do we do these 3 things? We're gonna break them down for you piece by piece here. Early strengthening through isometrics is the most simple kind of version out of all 3 of these. The goal here is to decrease pain and improve your muscular control. Okay, so typically if you have a lot of pain going through available range of motion, you want to start with early strengthening isometrics. If you don't have a lot of pain, then you can start with phase 2, which is progressing strengthening through the isotonics. Okay, so what do we do with isometrics here? We can do adductor isometrics, where you want to contract up to 50 to 75% of your maximum effort, but you don't want to push through your pain. So what does that mean? It means if you have like a nice kind of ball, a little bit of air in it, you can use a pillow. If you don't, put it between your knees as you're laying on your back in a bridge position, and you squeeze that ball. You can do 2 sets of 20 reps for about 5-second holds, and as it becomes easier and easier, you can increase your hold times from 5 seconds to 10 seconds to 20 seconds, and then so on. Okay, another great exercise is hip flexor isometric. So you can put a band around both feet, right? Lay in like a position where you're just flat laying on your back, and you can pull one knee to your chest and hold that knee there as the other one stays on the ground. Okay, that's a great one. You can hold for 5 seconds and really brace your core to work up that hip flexor strength isometrically, where you're not really going through range of motion. You're just keeping it there in place. Okay, the third one is glute medius isometric. You can do a banded squat hold. So you can get a nice elastic band that's looped, put it around your knees, go right above the knees, and you want to do 5 reps of a 10 to 30 second hold where you go into a nice little squat and you hold the squat at the bottom for 10 to 30 seconds, driving your knees out while keeping your big toes on the ground. That's really going to get that glute med on the outer parts of the hip to really fire and start to activate. Okay, and then the last version of this would be a lateral wall sit. So you can go next to a wall, and in a standing position, you can bend that knee a little bit. You can bend your right knee. Say you want to work your right side, you bend your right knee, put it against the wall, and you push your right knee into the wall, and you squeeze. You're actually going to be working the opposite glute. So the left side will be working to stabilize the leg, and you can do 5 reps of a 10 to 30 second hold there. Those are all awesome exercises to work on your isometric control and decrease your pain, so you can move to kind of stage 2, which we're going to talk about now, which is progressing strengthening through isotonics. So again, we're trying to improve our ability to kind of tolerate a little bit more load and improve our tendon capacity to handle that load, okay? Kind of like a tendonitis type thing. So bridging, hip thrusting, right? Marching resisted bridges, and then side plank clamshells are another kind of great exercise. So for the bridges, right, you can do 2 sets of 20 reps. You can stick your arms up towards the ceiling as you do them, and you want to get your butt up to the ceiling as well, trying to bridge them. So you want to kind of try to match it so your hips come in line with your knees, and there's a straight line from your knees, your hips to your shoulders at the top. And you want to really squeeze your glutes, and you can hold it for a good 5 to 10 seconds. All right, and you can do 20 reps of these. And guys, if you're like, I can't remember all this, he's talking about too much, he's going too quick, don't worry, we're gonna give you something at the end with all this information and pictures. So stay tuned to the end, and then I'll kind of give you directions on how to get access to that. The next thing is hip thrust. You can do 3 sets of 10 reps, typically 5-second hold. Hip thrust is the same thing as a bridge, right? Your back's just on the edge of a bench. You can put weight on your lap, and you can do a bridge hold there, okay? Or a thrust hold, I should say. Marching resisted bridges are very similar to the one I just mentioned with hip flexor isometrics. Now your feet are just on top of a bench. You're doing a bridge, and you're bringing one knee to kind of hip height, and you're holding for a period of time, typically about 5 to 10 seconds. 10 seconds usually works a little bit better because it's a little longer. Okay, you can do 2 to 3 sets of that for about 10 reps. The next one is side plank clamshell, right? This is an awesome one where you put that band right above your knees, you lay on your side with your elbow directly under your shoulder, and you try and kind of lift your hips off the ground, and you lift your top knee off of your bottom knee, and you hold it for about 5 seconds. This is going to be an awesome exercise, one of the best based on research to target that glute medius muscle on the outer part of your hip. Very, very effective, and it really helps if you have pelvic drop on one side compared to the other. Okay, so those are 4 great exercises you can try. And then our last kind of final thing here is movement re-education through motor control. Probably the most important phase that rarely gets addressed in physical therapy because sometimes therapists don't spend enough time with their patients or insurance cuts them off too soon. Okay, so what is motor control? It helps with your technique fixes for barbell training, right? It's your boss or your brain telling your muscles exactly what to do. So it's going to help you kind of order of the kind of routine exercise. It's going to help you control it, and it's going to help you maintain it. Okay, so hip airplanes is a great exercise. This is one you can do assisted hip airplanes where you're holding onto a bar in front of you or without anything. Obviously, without holding on to anything, it's going to challenge your stability a little bit more. You want to do about 1 to 2 sets of 10 reps where you hold each position, where you drop your hip and kind of go towards your belly button. That's internal rotation for 10 seconds. And then you go the opposite way, belly button to the ceiling for 10 seconds. That's external rotation. So this is like you're strengthening and working your balance and your range of motion. It's like everything combined, which is why it's such an awesome exercise. Okay, the second thing you can do is a single leg RDL, right, or Romanian deadlift, they like to call them. You can hold a heavy kettlebell or a dumbbell in the opposite hand of your stance leg, right? So say you want to work your kind of right side, right? You're going to keep that kettlebell in your left hand and keep all the weight on your right side. Okay, so the kettlebell or the dumbbell is always going to be in the opposite of the leg that you're standing on. Okay, that's a great one to do. You can kind of find sets and reps on that. Typically you want to keep the sets and reps a little bit low, volume a little bit lower. You can do 1 to 2 sets of about 8 to 12 reps. The next 2 are great. The R&T squat and the R&T split squat. R&T just stands for reactive neuromuscular training. Typically it means you're using a band to help you kind of increase activation of the muscles that are weak, okay? So R&T squat, very similar to what we talked about before, doing a banded squat hold. You want to put a band around both knees, so the band wants to pull the knees together. You have to actively think about pulling your knees apart, and that's going to activate your glutes, mainly your glute med and your glute max a lot more. You can do 2 sets of 20 reps on this one. For split squats, same thing, 2 sets of 20 reps on that. Split squats, you want to have a band trying to pull your knee inwards, right? So say your kind of right side is affected, it's your right hip that's bad. You want a band right above your knee, pulling it inwards to the left. That's going to require you to push your big toe and your foot down into the ground, drive your knee out to the side. And that'll be a really great way to strengthen those muscles and provide some stability and motor control to that hip. Okay, and the last one is touchdown squats. Touchdown squats are awesome. It's just a single leg modified squat off of an elevation. You kind of hinge at your hips, try and touch one leg to the side next to you and hold it for 2 to 3 seconds. And you can do 2 sets of 20 reps of that. Okay, so I know that was a lot, guys. So Because that was a lot, and you might have to go back and rewatch it, which I suggest you do. We're actually going to give you guys something if you made it this far to the end of the video. It's been about 10 minutes in total. Thank you so much for watching and kind of following along. Be sure to like and subscribe. And if you are liked and subscribed, thank you so much. We want to give you something to give back. So what we did is we created a full rehab guide that goes over all 3 of these phases, right? Early strengthening through isometrics, progressing strengthening through isotonics, and then movement re-education through motor control. It's going to cover all those exercises we just went over, your sets and reps. Everything is ran out for you with pictures as well. Okay, so if you guys want that, scroll down. You can see in the comments below. We're going to put it in the comments. We're going to put it also in the description below. One other thing we're doing, guys, that we found works really well over these past couple of weeks, this is somewhat new, is we're offering free 10 to 15 minute discovery calls to answer your questions or provide a little bit of knowledge to you to see if we can help you or refer you to someone who can. So if you guys are interested in that call, comment call down below and we'll get you set up for that, or email me at corey@choffnerptsc.com, which you can find in this video as well. All right, thanks guys so much. And stay tuned, we're gonna be starting a new topic starting next week. We're gonna address the lower back for the month of April, okay? Thanks so much and have a great rest of your day.